Good morning, everyone, and welcome to our Prestige PEO webinar series. My name is Shannon Shaw. I am Supervisor of Operations at Prestige PEO and your host this morning. Today, we will be talking about Aflac Group Plan options that are new to this open enrollment season. I am joined by Allison Durand, Prestige PEO's Voluntary Benefits Consultant. How are you today, Allison?
Hi, Shannon. I'm doing well. Happy to be here.
Awesome. Our webinar viewers are automatically muted, but we encourage you to utilize the chat feature for any questions you may have, and we will address them at the end of the webinar if time allows. If your question is not answered, we will follow up with you shortly after the webinar concludes. The webinar is also being recorded and will be posted on prestigepeo.com/webinars page so that you can refer to it at any time. And now I want to turn the mic over to Allison, who will lead the webinar today. Welcome, Allison.
Thank you, Shannon. So we'll start off I'll tell you a little bit about myself. Thank you for joining this information session for the Aflac Group Voluntary Benefits. Just a little bit about me is I've been in the voluntary benefits space for about 12 years now, and I actually previously worked for Aflac Group for a time. So I'm very familiar with the products. But now I'm on the consulting side with Voluntary, and just a fun fact about me is I currently live in Germany with my family because my husband is serving here with the U.S. Army, and we're just along for the ride. Right. So in this session, we're going to talk through the Aflac products and how they can help you and your family in detail. I will also be answering questions at the end, so feel free to type any questions that you have into the side navigation panel as we go through the presentation so you don't forget them. So first things first, how do you enroll in these benefits? During your enrollment period, you can access the plans via the Prestige PEO renewal portal to enroll. The URL is on the slide. I'm sure it's also posted in various places. I know that some of you may currently have Aflac Individual or United Healthcare products in force through your employer. And if you would like to keep them, you can do so, but you must contact your carrier, so either Aflac Individual or UHC, to set up direct bill payments, because those products going forward will no longer be payroll deducted. They're being replaced by the Aflac Group products that we're reviewing today. And a letter with additional information on how to continue your in-force coverage will be sent soon. So who's eligible for Aflac Group benefits? It's any employee who works an average of 19 or more hours per week, as well as their spouses, domestic partners, and dependent children of employees. And dependent children are eligible through the end of the month in which they turn 26. And we'll get right into our first product, which is accident insurance. So accident insurance pays cash benefits to a covered employee or dependent who is injured in a covered accident. And people often ask me, what is a covered accident? And it is just an accident that isn't excluded within the policy language. And at the end of this presentation, I will show you where to find all the exclusions for each product. So with all of these Aflac plans, claim payments are paid directly to the insured, you, the employee, unless you request they be assigned elsewhere. And traditionally, voluntary benefits help fill in the gaps of major medical coverage. So oftentimes they're used to pay for things like medical bills, deductibles, copays, but they really can be used for any purpose. So if you want to pay your rent or your mortgage or go grocery shopping or even just have an Amazon shopping spree, you can do that because it's your money to use as you see fit. There are two plan options to choose from. There's a low plan and a high plan. These plans do not include a pre-existing condition limitation or exclusion. There's no waiting period. There's no benefit reduction. And that really sets these plans apart from the industry standard. They're best-in-class products. So on the screen, I am showing some of the benefits that are included in the two plans. This is not all the benefits. There's probably something like 50 plus benefits. But at the end, when I show you where to find the brochures will detail all of the benefits included in the plans. What I'm showing on the screen is some of the most utilized benefits, and that's why I show these. So from the comparison, you can see that there is, a high plan, and that high plan is going to have higher benefit amounts, and therefore it's going to have slightly higher rates. So when you have a moment, you can compare these plans side by side by looking either on this presentation or in the brochure where it's going to have all of the plan benefits, and you can compare them side by side and determine what's going to work best for you and your family. The plan is rated based on 4 tiers, so you can choose who to cover. You can cover just yourself, the employee, yourself and your spouse, yourself and your children, or your entire family, which would be yourself, spouse, and children. And the rates for the products are monthly. We'll move on. Also, just to note, this plan and all of the plans that I'm going to show here today are portable if you do leave Prestige PEO. In this slide, I'm showing a claims example for accident insurance. So I'm using the high plan and I'm using the family rate tier option. And I'm actually going to break these examples down by employee, spouse, and child. So we will say that the employee was hospitalized due to a covered accident and they were confined for 5 days. They would receive the $1,000 admission benefit and 5 days of confinement at $200 per day. I'm showing a different scenario for the spouse. So in this example, the spouse is having an inpatient surgery due to a covered accident, and they're confined to the hospital for 3 days. So they would receive the $1,000 admission benefit, $600 for 3 days of confinement, a $1,200 benefit for inpatient surgery, as well as $175 for receiving a CT scan. And in the child example, we will say that they fractured their leg playing Little League. So they would receive $800 just for that ground ambulance ride, $150 to be seen in an emergency room, $75 for receiving an X-ray, and another $1,800 for the fractured leg. So the total claim payment for all 3 examples is $8,800, and the annual family premium is $243.24. So you can see the value there. We'll move on to critical illness insurance. Critical illness insurance pays a lump sum benefit upon the diagnosis of a covered condition. And I've listed all of the covered conditions on the right side of the screen. The benefit percentage that you see there is the percentage of benefit that would be paid upon diagnosis. Most of them show 100%, but you will see some that show 25%. And we're going to walk through a claims example on the next slide that details that and hopefully makes that a lot clearer for you. The guaranteed issue amount for this plan is $30,000 for employee and $30,000 for spouse. So spouses are able to elect up to 100% of what the employee elects, which is really, again, sets it apart from the industry standard. And children are covered at 50% of the employee's elected benefit amount at no additional cost. So they actually are automatically covered at time of claim. And because we're offering guaranteed issue coverage, there are no health questions to qualify. Employees can elect either $15,000 or $30,000 in coverage for themselves and your spouses. And some highlights of this plan are there's no maximum benefit amount, there's no benefit reductions, there's no waiting periods, and there's no pre-ex, but the date of diagnosis does need to be on or after the effective date of coverage. And under plan provisions, I've listed out the second and additional event benefits. And this plan will pay 100% of your benefit amount for the same or new condition. However, it must be separated by 6 months. So what that means is you could be diagnosed with the same condition twice and receive the $30,000 or whatever you elect, 15 or 30,000 benefit amount twice, as long as it's separated by 6 months or at least 6 months. In the next slide, I'm showing the monthly post-tax rates, and this is for employee and spouse. The rates charts are exactly the same. These rates are unique tobacco, which means that they don't change based on your tobacco status. The rates are also attained age, which means that they will change as you cross age bands. But that re-rating isn't done until the plan anniversary every year. So I'm going to walk through an example of this. So we'll say that I enrolled in January 2024 for a February 2024 effective date. We'll say I'm 24 on February 1st, but I turned 25 in March. I've now crossed into that 25 to 29 age band. However, I will not begin to pay that increased rate until November 1st because that is the following plan anniversary. And again, any questions you have, we could talk about them at the end of the presentation. Just remember to jot them down so you don't forget. Okay, so on this slide, the plan does include a $50 health screening benefit. So I'm showing a list of covered screening tests to receive the benefit. Just for example, I simply go to my annual physical and I file that health screening benefit claim, I would receive $50 for just going to my annual physical. So even if nothing bad happens to you, you can always just receive that $50 once per year, and it would be per covered employee, spouse, and child once per year. Okay. In the next slide, I'm showing a claims example for critical illness, and I'm using the 45-year-old employee here with a $30,000 benefit amount. And I'm going to show 3 years of possible claims. So the first year, we will say I'm diagnosed with human coronavirus and I'm hospitalized for at least 10 days. That pays 25% of my $30,000 benefit amount. That's $7,500. And just a note on human coronavirus, that does not mean just COVID-19. There are many, many human coronaviruses. We'll say in year 2, thankfully nothing happens, but I go to my annual physical, so I receive that $50 health screening benefit we talked about on the last slide. And in year 3, unfortunately, I'm diagnosed with invasive cancer, and that would pay 100% of my $30,000 policy. So now the total benefit amount for 3 years is $37,550, and my premium for 3 years is $1,116.36. Okay. We'll move on to our next product, and that's hospital indemnity. So hospital indemnity pays cash benefits when an employee or covered dependent is admitted and confined to a hospital due to sickness or injury. The rates are similar to accident in that they're 4-tiered. So you can choose to only cover yourself, the employee, yourself and your spouse, yourself and your children, or yourself, spouse, and children with that family coverage. And just like accident, there's 2 plan options available, the low and a high plan. The high plan does the higher benefit amounts and therefore the higher rates. So again, I encourage you when you have time to sit down and really compare these 2 plans and decide which one is going to fit best for your family and your budget. The highlights of this plan are there's no pre-ex, including for maternity and pregnancy. And this is huge because, again, it's very different from the industry standard. What this means is as long as your hospitalization is after the effective date of coverage, that hospitalization is covered even if you are already pregnant prior to the effective date. So, for example, we will say that I'm 6 months pregnant when I enroll in coverage in September, but I'm 8 months pregnant on the effective date, and I don't give birth and I'm not hospitalized for that birth and delivery until December, that plan would pay the full benefit amount without any reduction because that hospitalization was after the effective date of coverage. And we'll walk through a claims example for hospital indemnity. I'm going to use the high option again and the family tier rates. So I'm breaking it down again by employee, spouse, and child. And we will say that the employee was hospitalized for 10 days. They would receive the $1,000 admission benefit as well as 10 days of confinement at $150 per day. In the spouse example, we would say they're pregnant, so they were hospitalized for 3 days for the delivery. They would receive the $1,000 admission benefit and 3 days of confinement at $150 per day. The newborn child would also receive 2 days of confinement. We'll say that the newborn was born on the 2nd day of confinement. So they were only in the hospital 2 days. They would receive $200 of confinement at $150 per day as well. And in the child example, we will say that they were injured and hospitalized for just 1 day. They would receive the $1,000 admission benefit and 1 day of confinement. So the total benefit amount for all 3 examples is $5,400, and the family annual premium is $451.20. One question I am often asked is, can you, if you have multiple policies, let's say you have an accident and a hospital indemnity policy, can you file claims and be paid under both if you had a covered accident and you were hospitalized due to that covered accident? Absolutely. If you have both plans, both will pay. So our last product is short-term disability. Probably most of you are familiar with this, but short-term disability pays a percentage of your monthly income if you become disabled due to a covered illness or injury. And this is an employee-only coverage, so spouses and children are not eligible for this coverage. This would be employee only. Rates are based on the employee's age at policy issue and the benefit amount elected, which you can elect up to 60% of your monthly income. And we'll go through that a little bit more. There are two non-occupational plans to choose from. And a non-occupational simply means that the coverage is for illness or injury that occurs off job only. We are offering guaranteed issue amount of up to $3,000 per month. So there's no health questions to qualify for this coverage. And like I said before, the maximum income replacement is 60% of the employee's base salary, unless you do live in a state where there are state disability benefits, and then it's 40%. And those states are New York, New Jersey, Hawaii, Rhode Island, California, and Puerto Rico. And the reason for that is we just want to make sure that you do not become overinsured. The plan options, there are two. So the plan options are what we would call a 776 plan, and that means there's a 7-day elimination period for illness or injury with a 6-month benefit period. And then the second plan option is a 14-14-6, and that means there's a 14-day elimination period for illness or injury with a 6-month benefit period. One thing to note about this plan or these plans is they do include a 12-12 pre-existing condition limitation. This is the only plan that includes a pre-ex. But what that means is any pre-existing condition, disease, illness, pregnancy, or injury that occurs within the first 12-month period prior to the coverage effective date is not payable. So in addition, any disability resulting from a pre-existing condition diagnosed within the first 12 months of coverage is also not payable. And for pregnancy, it would be 9 months, first 9 months of coverage. One thing to note is that for those employees who do currently have Aflac individual short-term disability and are moving to the group plan, you will be given credit for time insured towards that pre-existing condition period. And I'm showing sample monthly rates on the bottom of the page. I'm just showing 1,000 and 2,000, but as I mentioned, guaranteed issue is up to 3,000, but is obviously also income-based. In this next slide, we'll talk about an STD claims example. So I'm using the 776 plan here, and I'm using a 30-year-old employee making $40,000 annually. In this example, the employee injured their back, helping a friend move over the weekend. They visit their doctor, and it's determined that they need to be out of work for 90 days while recovering. The plan would then pay 60% of their salary, up to $2,000, for the length of their disability after the elimination period of 7 days is met. So the total benefit amount for the 90 days minus that 7-day elimination period is $5,532, and their annual premium is $913.20. Okay. And on this slide, I have embedded all of the product brochures for Aflac so you can read through them fully. These brochures are where you're going to find all of the benefit details, all of the limitations, exclusions, terms to know. The limitations, exclusions, terms to know are located in the back of the brochure, so you'll want to scroll down and read through those fully. I definitely encourage you to do so before you enroll in coverage. They're housed in many places, including, I believe, on your resource center, but they're also going to be loaded into the enrollment portal. So actually, as you're going through enrollment, they can be viewed there as well. And that concludes the presentation. So we will open it up for questions. Shannon, do you want to read if anything came in? I can't see the questions.
Sure, we do have a couple of questions that came in through our chat. One person asked, would this short-term disability replace what the employer is already offering, or is this in addition to the employer paid short-term disability?
Well, it may be a question for Prestige, but most of the time it's in addition to, it does not replace. It's not meant to replace an employer paid STD benefit.
Okay. Another question is that one employer pays for short-term disability for employees 50%. Can they also elect Aflac?
Yes, you can also elect Aflac.
Awesome. I think that looks like all the other questions have been addressed by the presentation. So if there's anything else you wanted to share, Allison?
I think that's it. Those are the frequently asked questions. I will mention one more thing. On the accident coverage, one of the exclusions is for professional sports, and emphasis being on professional. That means you're paid to play. So it does not mean your child's Little League game or cheerleading or anything like that. It is truly, are you getting paid to play? So when you see that exclusion in the brochure, that's what that's referring to.
Okay, Allison, I did miss a couple of things. Um,
Okay.
Someone asked about the brochures and where to find those brochures.
Okay, so let's see. So there are on the PrestigePEO Open Enrollment Resource Center, I believe, and then they're also, as you go through enrollment, they will actually be attached to each plan within the enrollment system. So I believe it's labeled SPC on the enrollment system. You click on that and it'll pull up a PDF. But they're also on the Resource Center, which it looks like there is a URL to on this presentation.
Okay, oh, fantastic. Okay, and the only other item I'm seeing is if you have accident insurance with a primary insurance, can you still elect Aflac?
Accident insurance as a primary insurance, I would need a little bit more detail on that. Does that mean if you have another accident voluntary benefit insurance?
I
Or is there some sort of accident coverage on your I'll say this, Aflac does not look to what other coverage you have. So they're not going to check to see if you have coverage with another carrier or coverage that was covered by major medical. They're simply paying on what is in the plan benefits. So
okay,
there's no coordination of coverage between carriers. I
okay.
hope that answers the question.
There was some additional information added. The primary insurance covers ambulance. Would you still get additional benefit for the accident under the accident insurance?
Yes, definitely. So Aflac does not coordinate between your major medical coverage. So it doesn't matter if you have no medical bills at all. If you have a ground ambulance ride, that's a payable benefit. You're paying for this coverage. You could have a zero copay or a zero co-insurance or no medical bills, and Aflac would still pay.
Okay, that
Yeah.
looks that looks like most of our questions. Thank you for letting us know where to get access more information. There were some questions about that, so I hope people visit our site and access them there. Thank you so much, Allison, for this valuable presentation, and thank you to everyone for joining us. You can view this webinar recording along with helpful videos, guides, and timelines on our Open Enrollment Resource Center at www.prestigepeo.com/open enrollment. If you have any further questions, you can also reach out to your benefits specialist for additional guidance. Finally, remember to download our Prestige Go mobile app for access to your benefits information and support from your HR team members on the go. Thank you all, and we'll see you next time.